Say hello and thank you for joining us on our Safer to Wait videos. I'm joined by two doctors today, Dr. Helen Westwood and Dr. Ros Jones. I wonder if I can ask you both to introduce yourselves briefly for our audience. Helen, if you could start.
Yeah, so my name's Helen Westwood and I'm a GP working in South Manchester area. I've been a GP for about 18 years now, and so in that job, obviously, I see a lot of children.
Absolutely, I can imagine. And Ros?
Yeah, I'm a retired paediatrician. I was a consultant in a busy district general hospital in Berkshire, and I've been retired 10 years, so I'm not going to be giving any medical advice, but having said that, the general principles of what we're going to be discussing have not changed.
Awesome, thank you both. And I suppose we're speaking in the context of a situation where lots of parents are feeling some reluctance to take their children to an NHS setting, whether that's because they're worried about overwhelming the NHS when it's busy and the long waits they might have to go through, or whether there might be in some cases an element of distrust where they feel there's been some unusual advice from the NHS. Could I ask your responses to that kind of setting? Helen first, if you don't mind.
Yeah, so I mean, I think that's entirely reasonable. There are a lot of parents who will be feeling that way. Maybe a lot of trust has been lost, like you say, because of everything that's been going on in the last sort of 3 years. But what I would say is that certainly myself as a GP and my colleagues, our main focus, our main priority is the patient in front of us, particularly if that is a young child. We just want to make sure that that child is okay. And if the parent comes to us and they're worried and we examine the child and find that the child's fine, then that's great. We'd rather do that and reassure the parent that the child's okay than have a parent worrying at home and maybe a child getting more poorly, if they didn't come and see us. So I would say if you're worried, by all means, come and see us. We will always see children as an extra. If the surgery's full, if a parent is worried about a child, we will see that child.
Thank you. Ros, would you like to add anything to that?
Yes, I think you're right. I think there has been a lot of anxiety. I think particularly with all the things that clearly were very excessive and detrimental to children, excessive use of masks, parents being asked to wear masks in a children's ward. Not the children were ever asked to wear masks, I don't think, but the parents were, and that I think would have been very distressing if you've got a sick child and they can't see your face properly. And also excessive testing, and the vaccines, some of the advice about vaccination and not looking at natural immunity and so on just didn't make a lot of sense. But having said that, my contacts with my colleagues at work are that they absolutely have still got the best interests of the children in front of them, and they're not following some rigid protocol that has to be followed. And so, yes, as Helen says, please, if you're worried, most situations you'd go first to your GP, but there will be situations where a child's, suddenly become acutely very ill, where you need to go direct to hospital, and don't be afraid to do so.
Thank you. And I suppose the first question that I'm a parent of young children myself. I've got 4-year-old twins. And one of the questions that comes up most for me, and why I sometimes message Ros in an emergency and say, I'm worried about this thing, should I worry? Is when should we worry about things that are going on with our children? I know it's difficult to give an exhaustive list, but I wonder if I could ask you, Helen, like what advice you would give to parents about things that might need a more urgent response and so on.
So I think one thing to say is that young children particularly, they do get lots of illnesses, lots of coughs, colds, that sort of thing. And so that is quite normal for children to get a lot of those things, particularly in the winter months. And children, they'll often get poorly, but they get better quite quickly as well. So although you might be worried about them, there are some simple things that you can do yourself at home. I don't know, I think you had a leaflet, the When Should I Worry leaflet, which is really, really helpful. And we can perhaps share that with this video. So that gives you a lot of useful advice. So if a child's got a temperature, simple things like paracetamol, stripping them down, cooling them down. And you'll often find once the temperatures come down, the child perks up, running around again, back to normal. And so, you don't need to worry. But if the child not getting better, I think as a parent it's natural to worry, but when something's seriously wrong as a parent, that. So I think you need to trust your instincts, in many respects. If I have a patient a parent bring a child into the surgery to see me, and the parent says to me, I know there's something wrong with my child, I will take that seriously, because nobody knows the child better than the parent, and the parent knows if there's something not right. So I think trust your instincts, but also, do some of the simple things at home, rehydration, controlling the temperature and that sort of thing. And, often things will just settle down within a couple of days, and you don't need to worry about it.
Thank you. Ros, would you like to add anything on that?
Yeah, I absolutely second what you said about following your instincts. I mean, that was one of the things we always taught to our new juniors as they were coming in, was always believe the parents. The only problems we would have were when we have a slightly cocksure junior doctor who thought they did know better than the parent. And usually our nurses were fantastic, because they'd been there a lot longer than the junior doctor, and they would come along and say, no, listen to the parent. And I would also say in inpatients, listen to the nurses too, because they had that feeling for whether you get to know after a while, which children really are ill and which aren't. And it is partly a gut feeling, and you can do tests and all sorts of things, but at the end of the day, you can't test every child for every condition. You have to use some judgments, and that again, for the parent, you don't want your child to be over investigated. That you said worrying is normal, and there's a spectrum from parents at one end who are so worried that their children will then land up getting lots and lots of unnecessary investigation, which is quite traumatic. And at the other end, who are so laid back as to not realise their child's really ill. But most people are in a nice sort of in the middle way. They are anxious appropriately, and they need to listen to their anxieties. And as you say, one of the things I noticed on this When Should I Worry leaflet, on the top of the front page, was when you go to see the doctor, explain to them what you are worrying about. Make sure they understand what you're worrying about. And I'm sure that's good advice for parents.
Yes, I recently, my son fell off a swing from a really low height, and my husband said it's nothing to worry about at all. And I took him to the hospital, and they were saying, okay, we're going to do an X-ray. And I was really resistant to doing lots of X-rays on things, because I was like, oh, I'm worried about the exposure and it might be unnecessary. And I sort of, expressed those risks to the people who were dealing with me, and they gave me some reassurances. Actually, he did have a small break in the end. We did do the X-ray, but I think I suppose one of the things we're told, like when I did my NCT classes, was whenever you can, ask your doctor what's the option. What happens if I don't do anything in this circumstance?
Yeah, that's really important, especially with young children. The frequent sort of viral infections. The vast majority of children don't need any treatment or any tests or anything. All they need is reassurance and maybe, some paracetamol, and lots of cuddles, and,
And to come back to that, of course, again, there's a bit of sort of question that fever is a useful part of fighting infection. So you look under the microscope, if you warm the blood up, the white blood cells start dashing around, and it's actually part of the body's physiological mechanism, the natural response. So actually, you don't necessarily need to give anything. But having said that, I agree with Helen. It's really useful, because you can have a child who's totally floppy and disinterested, and you're thinking, do we need to be checking them for meningitis or something? And you give them some paracetamol and come back half an hour later, and they're running around playing. So it may be useful just partly to reassure yourself. But once you're happy that the extreme lethargy was just the fever, you don't need to keep blurring the fever, and there's not that much evidence that doing that will stop them getting fits, because I think that was always a worry, that kids with high fevers might get fits, and most
parents worry about that a lot.
And parents worry about that, and if you're genetic, some people are more genetically, if they're febrile fits in the family, your child's more likely to get them. Having said that, I don't know if there's really evidence that keeping the temperature down will make much difference to
I think I researched that, because it was a concern of mine at one point, and I certainly read somewhere that it was not particularly helpful for reducing the likelihood of seizures, but that's helpful to know that it could be a way, if you're really feeling quite worried, that it could see if it perks them up a bit. And I suppose that brings us nicely to you mentioned meningitis. I'm conscious that's a rash that parents do need to look out for, but are there particular because kids get rashes all the time, what kind of rashes should we worry about?
Yes, well, that's this lovely one. There's a picture in the book of how to do the glass test, and it is really, really useful. It's quite easy to do, and if you've got an average sort of viral rash, it can look quite red and blotchy, but when you put the glass and you press on it and you're compressing the skin, it just disappears, the rash, and you can see it through the glass. But if the rash in meningitis is actually little blood bleeding it's bleeding out of tiny blood vessels into the skin. So when you press on it, you're not going to make the blood go away because it's already there in the skin, like a bruise, so to speak, like miniature tiny pinprick bruises. So it's very clear when you put the glass there, they don't blanch. If you have a child with a non-blanching rash, you should always take that seriously.
Thanks, Ros. And Helen, are there any other rashes that parents need to worry about?
Generally, most rashes are nothing serious. Like Ros says, you know, all sorts of viral infections will cause rashes, and the vast majority are absolutely fine. But if any parent is ever worried about a child that has a rash, we will always happily just check them over. Yeah.
And what about rashes that are like, for example, chickenpox?
Yeah, so chickenpox is very, very common, very contagious. Most children get it when they're quite young. Usually it goes through the whole family at the same time. And that causes really itchy blisters. And the child is often quite miserable with those, and scratching at them. But again, it's not serious. The vast majority of cases just settle down. We normally recommend to use something like calamine lotion, which just soothes the itch for them. And then once they've had it, they're then immune to chickenpox, and it's very, very rare that they would get it again afterwards.
And the other sort of rashes, I suppose, to just touch on is allergic type rashes. Because again, I think sometimes children like chickenpox, you get these little tiny blisters like a nettle rash. So you might be thinking, if your child had something like that, you might be thinking, you know, was there something they'd eaten that had set it off? But so the other thing is, you know, have children who say, for example, have eczema, and they have always got eczema, or not always, but they'll come and go in flares. But then every so often they'll end up getting infected. So bacterial infection of the skin, as opposed to these viral rashes that, as we said, don't matter. You know, can be quite weepy, and they look much more manky. It was scientific word there, you know, manky.
Good to look out for manky scratches. We'll do that. Thank you.
Yeah. And then they might need some antibiotics. So again, it would be worth it. And you can, if you're really in doubt, you can always take a picture. And, you know, I think there's been a lot of worry about the fact that general practice and hospital follow-ups too, a lot of it just seems to have gone online for way beyond. I mean, some follow-up things may be very useful to do online, and I'm sure we saw patients that we didn't need to. But the idea of a new patient you've never seen being assessed online isn't great. But things like dermatology clinics, you can absolutely do them on a Zoom link or whatever. And show, you know, oh, here's this rash. What do you think of this? So, you know, you may well just want to send a picture to your GP.
I think a lot of parents do find that quite helpful if they're not particularly worried that the child's really poorly, but they want to know what is this rash, and then they can send a picture in. Especially if the parents at work, we can give them a call back at a time that's convenient for them, rather than them having to take time out of work to come to the surgery. So yeah, those kind of things are helpful.
Thank you. And Helen, another one for you. What about when children are vomiting? At what point should parents worry there?
Okay, so vomiting again is very, very common, and most of the time it's what we call self-limiting, so they will just get better. But you do worry, particularly with young children, that with vomiting, children can get dehydrated, especially if they're not wanting to eat and drink. So it's really important, if a child is vomiting, to make sure that they're drinking as well. I normally recommend to parents that they give the child little sips of fluid regularly, rather than a big drink in one go. You often find if a child has a big tumbler full of juice, and then it'll just come straight back. So it's best for them to just have little sips frequently. And then the thing to watch out for is, are they passing urine? Because if they're passing urine, then that shows that the fluid's going through. If a child isn't, you know, if a young child isn't wetting their nappies, or an older child isn't going for a wee, then that's a sign that they could be dehydrated, and it's probably worthwhile them, you know, seeking medical attention. Another thing that is quite helpful that parents can assess themselves for dehydration, that it's something we do when we examine children. It's called the capillary refill time. So basically, similar to what Ros was talking about before, about doing the tumbler test for the rashes, you can just press a finger just on the breastbone, and then when you let go, the skin goes from white back to pink. And if that takes less than 2 seconds, then that indicates that the child is well hydrated. If it takes longer than that, then that's the sign that we would be worried about and we'd be wanting to see the child. In fact, that might even be a situation where you take the child directly to A&E rather than to the GP, really.
Thank you. And if something like that did happen, for example, with the thumb test, would you recommend calling 111 first? Can that help get seen more quickly when you go to A&E?
So I think 111 is very helpful for a lot of advice. That they may be able to arrange an assessment directly with the paediatric assessment unit. Depends on your local arrangements, whether there's a direct system like that, or they might just advise you to take the child into A&E. But usually children, when they're taken to A&E, they do get prioritised, so they often don't have to wait, the long waits that adults often have in A&E.
That's helpful. And just, I suppose, to anecdote from my own experience for other parents in case it's useful, I found it really, my surgery recently switched to an online system, and it's really difficult just to figure out the tech for getting an appointment. But I was able to call 111 and they booked an appointment with my doctor for me when I couldn't. So if you're in a bit of a bind, not just routinely but for urgent things, then
if it's urgent, then 111 can do that.
Thanks, Ros. Did you want to add
something? The other thing I was going to say is when you need an ambulance, because obviously if an adult is really sick, you may need an ambulance to transport them. But most children, if you've got two parents, then it's easy because one can drive and the other one can sit, might go and sit in the back seat, so you can sit beside each other and be sort of looking out for them. But if you're on your own, and you've got a child who's vomiting and they've really got a high temperature and so on, driving while you've got a child sitting beside you is not great. It's not good for your concentration on the driving, but it's also, if they're suddenly, you think they're losing consciousness or something, so if you've got a child you're really worried about, I don't think should hesitate to call an ambulance. Or you might just get a taxi if that was easier, or find a neighbour, say to the neighbour, please, because particularly with ambulances, if there have been long waits, get your opposite neighbour to take you.
Yeah, thank you. That's really good advice, because that's the kind of thing you don't think about in the moment. You think, I'm just going to get in the car as quick as I can and go, but then you could put yourself in quite a dangerous position. Thank you. That's good to know. And how about diarrhea? That's another one.
Yes, because I was going to say, after the vomiting, most children vomiting will also have diarrhea, which of course makes it more of a problem for the dehydration. That you're not only losing, it's coming out both ends, but as Helen says, lots of little, and every 5 minutes another sip. And just general squash is quite good, or you can use those sachets of sort of rehydration solutions. But if they haven't got diarrhea and they're vomiting, you do just need, if you've got constipation and vomiting, you need to be a bit more worried. And one absolute key thing is if they're vomiting anything green, I would always be worrying about, have they actually got some sort of obstruction? It's rare. Yeah. The vast majority will be just an ordinary sort of gastroenteritis type bug. And again, with the diarrhea, you're just thinking about, can you really keep up with the fluids?
The rehydration sachets, often children don't like the taste of those, and so they won't take them. So I always tell parents, give the child whatever fluid he or she will take. If they'll take water, that's great, but if they need a little bit of squash or something in there to make it taste nicer, then do that. The most important thing is they get the fluids. It doesn't matter about everything else.
We used to tell them to use flat Coca-Cola, not Diet Coke. I mean, you actually need sugar as well.
Sugar, yeah.
So actually water on its own is probably not the best if they're really unwell. They will need some, because they're not eating. Water's fine if you're eating, but if you're only having water, then a squash will have some salts in it. But flat non-Diet Coke is good.
And you mentioned, Ros, just so I understand, were you saying if the vomit itself is green, that's potentially cause for concern?
Yes. I don't worry if the diarrhea is green, that's all right.
No, that's normal.
No, but if the vomit is green, it implies that there might be an obstruction in the high just below the stomach. So it's bile coming up in the vomit, which shouldn't be. Usually they'll be vomiting what they've eaten. And obviously, again, if there's blood in a vomit, you would always take that seriously.
And then bowel movements generally, Helen, is there anything we ought to watch out for with children's bowel movements outside of diarrhea?
Well, so constipation is very common in young children, and it can be a problem because what can often happen is that it gets painful when they go to the toilet. So then the child will sort of try and hold on and not go to the toilet, and then the constipation gets even worse. So you can do simple things at home, just increase their fluid intake, perhaps have some prunes or, something like that just to help. But if those kind of things aren't working, then, we do sometimes give a medicine like lactulose, which can just soften the motion, just makes it a bit easier for the child to go. So, because what we want to do is for them to be able to go without it being uncomfortable and painful for them.
My son won't thank me for sharing this, but when he was 3, he used to sit on the toilet, and if he was having a difficult time, he'd say, "Oh, Mum, I need a date." Help him pass.
As opposed to a prune, I like that. Yes, I need a date. Any
Okay.
fruit and veg are good, apart from bananas, I think, which have just the reverse effect.
Noted. Brilliant. That feels like a healthy sort of canter through some key things that to look out for. Is there anything you'd like to add for parents to look out for as a potential cause for them to seek urgent help?
I think I would just reiterate to sort of trust your instincts as a parent. If you are really worried, then you need to get help.
Yeah, I think the other thing we were talking about, like if they're getting dry, if they're not passing enough urine, but I think the other thing is whether how well they're responding to you, because even if a child's really unwell, they may not want to play, but you can get eye contact. You know that they're awake and that they're recognizing you. If you've got any doubt at all that your child doesn't actually know who you are, that is a major red flag, and that could be because they're severely dehydrated, and that's all they need is some fluids, and then they'll suddenly liven up again. Or it could be, for example, if they had got, let's say, meningitis or something, or a new diabetic. There are various causes of child becoming unconscious, but they don't just usually go straight from conscious to unconscious. There'll be this phase where they're getting more drowsy, and of course if you're unwell you sleep a lot, but it's the quality of that, and then when they're waking up, are they just interacting in a way, even with a youngish baby, you can tell as a mum, as you said, a parent, particularly it is this thing of trusting your gut instinct, that if they're not looking at you in the way they normally would look at you, if they're looking glazed and so on, I think that would be a worry.
Yeah, that's great. Thank you both for your time. That's really helpful. I hope we'll have further conversations with you to pick up things that might be worrying our parents. Thank you very much. Bye.
Thank you.
Thank you. Bye.